Good morning, everybody, and welcome to this week's episode of Tooth Teacher Tuesday. I'm your host, Dr. Stephen Zahm, and this week we've got another episode of Oral Pathology Corner. And today's topic is something we call in dentistry fibromas. Now, fibroma, as you can kind of tell from the name oma, sounds like a tumor, and that's essentially what a fibroma is. It's a benign tumor that is just basically tissue-filled tumor that is be found just about anywhere in the mouth. Most common places would be either inside of the cheeks, lips, or along the side of the tongue. They kind of look a little something like this. And as I mentioned, fibromas are benign tumors. They're typically nothing to worry about. A lot of times there can be different causes for them, but most times fibromas are the result of an area of continued trauma. You know, you think of if you're a person that constantly bites your tongue while you're talking or chewing, that continued trauma over time, rather than making a little sore there, that sore can start to develop and kind of balloon out into this little ball of tissue, and that's a fibroma. And since it is benign, typically no concerns with it as far as urgency of treatment. Most people either choose to leave them alone, or if it's kind of in an area where it's a nuisance, like the inside of the cheek, for example, they'll have it surgically removed just to get it out of the way so they're not biting it all the time. But like I said, fairly common oral presentation, nothing to be worried about, although like always, any kind of swollen bump on the inside of your mouth, don't just assume that it's something simple and benign like a fibroma. Make sure you see your dentist or other healthcare professional to have it evaluated and make sure that it isn't something else. But otherwise, quick little oral pathology corner for today. Hope this was informative for you, and look forward to seeing you next week on Tooth Teacher Tuesday. Have a great day, everybody.